Hi, my name is Lucinda Spencer. I'm an FNP student at Maryville University in St. Louis, and today I'll be demonstrating the head-to-toe physical exam on my patient MS, who is a 42-year-old male. I have asked him to empty his bladder and to go ahead and disrobe, and given him a sheet to cover up with for his comfort. So we did his height and weight prior to coming in. His height is 5 feet 11, weight is 195 pounds. And so we'll get started with the vital signs. Let me go ahead and get your blood pressure. Okay, so I'm going to hold on to your arm. Just relax that for me and let me take the weight. Okay, your blood pressure is 124/80, which is really good. We'll go ahead and check for your pulse. Okay, and his heart rate is 64 and his respiratory rate is 14. His pulse is strong and regular, and his respirations are non-labored and regular as well. So I will go ahead and start the exam, and I'm just noting his general appearance. And so I'm looking at face on, I'm looking for symmetry of the scalp and the head. Looking to make sure the ears are at the same level, the eyes are symmetrical, the nose is straight, the lips go straight across. There's an even distribution of facial hair. There's no facial droop on either side. So I will go ahead and start just palpating around on the scalp. I'll palpate the hair to see if there's any dryness. And there's not. I'm going to palpate the scalp for any contusions, any swelling, anything like that, and that all feels normal. And so I'm going to go right into the exam of the lymph nodes, and I'm going to palpate the posterior cervical chain. And I'm going from the mastoid bone down. And I'll palpate the anterior triangle, front of the auricle, and in the supraclavicular area, and the infraclavicular area. Okay, and I don't note any. So while I am assessing his neck, I will also assess to make sure his trachea is midline, and so I'll feel the sternal notch. From there, I will go up to the trachea on both sides, and that is symmetrical. There's no tracheal deviation. I also note that he has no jugular vein distension on either side. I'm going to feel the carotid pulse on each side. Okay, and that's normal. I'm going to assess the thyroid gland. I'll find the carotid or the cricoid cartilage, go below that, both sides of the trachea. Okay, and swallow. All right, and the thyroid is small, movable, with no nodules noted. So while I'm on the neck, I'm going to have him do some passive range of motion. So can I get you to put your ear to your shoulder, and the other side, and your head all the way back, and your chin to your chest, and look over your right shoulder and your left. Is there pain with any of that? Okay, and so let's do that against resistance. I'm going to have you just tip your head over into my hand, and the other side. Okay, and I'm going to have you push your face into my hand. All right. checking for any pain or weakness on either side, and I don't note any. So from here, I'm going to feel for sensation or test for sensation on his face. I'm going to have you close your eyes and tell me when you feel me touching you.
Yeah.
Okay.
Yeah. Yeah. And yes. Yes.
Okay, very good. So he's got sensation to light touch all over his face. So I'm going to have you do a few things for me, and I'm going to stand right in front of you to make sure that both sides are symmetrical. So I'm going to have you raise your eyebrows and wrinkle your forehead, all right? Squeeze your eyes closed as tight as you can, okay? And puff out your cheeks and blow. Okay, very good. Smile and show me all your teeth. Stick your tongue out and move both sides. Okay, very good. So I'm also going to have you open your jaw, okay, and close it, open it, and close it again, and squeeze it tight. Okay, very good, nice and firm. And so while I'm here, I'm going to palpate the facial bones and just note any soft spots, any lumps, any tenderness to any area. Palpate the maxillary bones and along the mandible. Okay, I'm going to palpate the sinuses. Is there any tenderness here?
No.
All right, very good. I'm also going to note that the nose is midline, and I'm going to note that the septum is also midline. Are you able to breathe out both sides of your nose? I'm going to have you occlude one side and breathe in and out, and the other. All right, very good. And so while I'm here, I'm going to check the eye movement. So I'm going to have you just follow my pen with your eyes, keep your head still, and go out to each side. And checking the 6 cardinal fields of gaze. And he has good extraocular movement and no nystagmus with that. I'm going to check the pupil response. Just look at me. So while I'm shining a light in one eye, I'm also checking that both pupils are responding. And his pupils are equal and reactive to light and accommodation at about 4 millimeters. While I'm here, let me also look in your throat. Okay. Looks like he has no lesions on his oral mucosa. Tongue is nice and moist. Teeth are all intact. Throat is clear. There's no tonsillar enlargement, no exudate, no drainage or erythema noted to them. All right. So while I'm here, I'm also going to inspect the penna or the auricle, and I'm going to do an otoscopic exam. Okay. So I'm going to inspect the penna, and I'm looking for any lesions, any bumps, any discolored skin, and I do not note any. I'm going to watch as I go into the ear canal. Okay, and I see the ear canal is clear. I have a good light reflex, and that TM is nice and smooth. There's no redness and no drainage noted to them. I'm going to go to the other side here. Okay, and I note that this ear canal also has no erythema to it, no drainage. It does have cerumen impaction, including the TM. Okay. Noting the auricle on this side has no lesions, no deformity, no discolorations, anything like that. So while I have my specula on the otoscope, I'm going to assess his nasal turbinates. Okay, and they both look normal. They're nice and pink. There's no drainage, no erythema, no irritation noted to that area. So while I'm on the head, I'm going to do my ophthalmoscopic exam. Get my light turned down just a little bit. I'm going to take my glasses off. All right, so I'm going to have you look out into the distance there and just fix on one object. I'm going to get real close. All right, he's got a good light reflex. The optic disc appears flat. The vessels appear normal and no aneurysms or any bleeding noted to them. Go look at the other side. Good light reflex. Okay. And again, the optic disc appears flat. The vessels appear very normal. There's no bleeding or aneurysms noted to that area. All right, so while I'm also in the neck area, I'm going to listen to the carotid arteries. I'm listening for bruits. I'm going to have you hold your breath. Okay, and breathe normal. And I'm going to listen to the other side. Go ahead and hold your breath. Okay, and his carotids sound very normal. There's no bruits noted to that area. So I'm going to go ahead and move down to the chest, and I'm going to inspect and note that the color of the chest is all very uniform and symmetric. The disbursement of the hair is very symmetrical. There are no lesions, deformities, or masses noted on inspection. I'm going to go ahead and auscultate for lung sounds in the front and the back. Big deep breath. Okay, I'm going to have you raise your arms up above your head and fold them. I'm going to listen on both sides. Big deep breath. Okay, and you can go ahead and relax your arms, and I'm going to listen to the posterior aspect. Deep breath. Okay, and his lung sounds are clear and equal bilaterally. Good equal chest expansion bilaterally. Okay, so while I'm back here, I'm going to have you turn just a little bit to the side. And I'm going to check for chest excursion. All right, so go ahead and take a big deep breath for me. And out. All right, so I'm checking to make sure my hands are moving symmetrically when he inhales and exhales, and they do. And so while I'm back here, I'm going to go ahead and percuss the lung fields. And the lateral aspects. Okay, and there we're nice and symmetrical. Another thing I'm going to do while we're back here, I'm going to just palpate both sides of the chest, feeling for any subacute air, any instability, any flail segments, crepitus, anything like that, and I do not note any. I'm also going to have you say 99.
99.
99.
99. 99. 99. 99. 99.
And I'm feeling for tactile fremitus, and it's equal throughout. And so I'm going to palpate the front of the chest. Again, feeling for any subacute air, any instability, any crepitus, any flail segments, and I do not note any. Okay, so I'm going to have you say 99.
99. 99. 99. 99.
Okay, and so the tactile fremitus is equal throughout, so I'm going to percuss the anterior chest. and so he has dullness over the area to the left of the sternum, as well as to the right lower chest area where the liver would be. I'm going to listen to heart tones. And the heart tones are all audible. I hear a very nice S1 and S2 to all the areas. No murmurs, gallops, or clicks noted. And so while I'm doing his assessment, I'm also going to palpate for the area of maximum impulse. Okay, and I note that. There are no heaves, thrusts, anything that would be abnormal in that area as well. And so going from the top to the bottom, I'm also going to assess his upper extremities. And so I'm just going to assess and feel for temperature, color, any changes in the skin, which I do not note, equal hair distribution. I'm going to feel for radial and brachial pulses to make sure they are equal bilaterally. And they are. We're going to assess for strength. So I'm going to have you hold your arm up and don't let me pull it up. Okay, and don't let me push it down. All right, and same here. Don't let me push your arm down. Don't let me pull it up. Okay, very good. We're going to do the same on this side. Feel for your pulses. They are equal, strong, and regular. Okay, so don't let me push your arm up. Don't let me pull it down. Out to the side. Don't let me push it down. Let me pull it up. All right, very good. Let me have you squeeze my hands. Very good, nice and strong bilaterally. Okay, I'm also going to have you just hold your hands out. I'm going to inspect the hands, the color of the skin. It's nice and pink, warm and dry. He has a brisk capillary refill. Nails are smooth and even. I'm going to have you go ahead and put your nails together like this. And the next one, and the next one. Okay, and I don't know any nail clubbing. So we are going to skip over the abdomen at the moment and go and assess the reflexes and then get to the lower extremities. All right, so I'm going to have you relax your arm. Let me hold it. And palpate. Check your brachial reflex here. Okay, and the back side. All right, good response. We're going to try the other side. Oh, well, just relax it. Let me hold on to it. Okay. Back side. Okay, so he's got good responses there. I'm now going to assess his patellar and his Achilles reflex. So since we're in a low chair, I'm going to put my arm under your leg here. Just have you relax that all the way. Just leave it dangling, okay? Okay, and I know a diminished reflex. He's got just a slight reflex there. All right, relax your leg. And equal bilaterally. And I'm going to check his Achilles reflex. And I'm going to check for clonus. Move this foot up and down several times and hold it. And I note no clonus. I'm going to try the other side and check the Achilles reflex. Okay, and he's got good movement. And checking for clonus. And I don't note any. So while I'm down here, I'm also noting that his legs are both equally warm in temperature. The color is very similar. I'm checking for pedal pulses and posterior tibial pulses. He's got good capillary refill to his toenails. His nails are nice and smooth and even. I'm checking on the right foot for pedal pulses and posterior tibial. And the nails are nice and smooth and even on that side as well. So I'm going to check your musculature in your legs. So I'm going to have you raise up your leg and don't let me pull your leg out. Okay, don't let me push it down. Very good. On the other side. Don't let me pull it out and don't let me push it down. All right, and so I'm going to put my arm or my hand on the top of your knee and I want you to raise it just a little bit. Don't let me push it down. All right, and same thing on this side. Don't let me push it down. All right, very good. So I'm going to have him go ahead and, before I have you lay down, let me check for CVA tenderness on both sides. Any tenderness there? Any tenderness there? All right, very good. So you can go ahead and lay back. So as he lays back and I'm inspecting his abdomen, I'm looking that it is nice and flat. I don't see any discoloration, any abnormal vasculature, any masses, skin lesions. I don't know any areas of pulsatile masses. So I'm going to go ahead and listen to vowel sounds in all quadrants. And while I'm listening, I'm also going to listen for the femoral pulse. I'm going to feel for the femoral pulse and listen for any groovies there. And I'll listen on the other side. Okay. He has good femoral pulses bilaterally. They are equal in strength, and I note no groovies. So I'm going to percuss the abdomen and the liver. So let me get my measuring tape here. All right, and so to percuss the liver, I'm going to start in the chest area. Okay, and so it's right at the nipple line that I hear it change to dullness, and I'm going to go to the area of resonance. Okay, and so that's where it changes. And I've got about 8 centimeters of measurement for the liver border. I'm going to percuss the rest of the abdomen. And I'm going to percuss for the spleen. It's right at the costa margin where I start to feel the spleen. I'm going to do light palpation. Any tenderness?
No.
I'm going to feel to see if I can feel the arteries, the aortic artery. Okay, I'm going to listen to see if I can hear any groovies there. I can palpate the aortic, abdominal aortic artery, and no bruits are noted at that time. So I'm going to do a deep palpation. I'm going to start with the liver. All right, take a big deep breath in and out. Any tenderness there?
No.
The liver is tucked up under that costal margin. I'm going to feel for the spleen. Big deep breath in and out. Any tenderness there?
No.
And the spleen is up under that costal margin as well. I'm going to feel for the left kidney. Any tenderness with that?
No.
All right, and I'm going to feel for the right kidney. Relax. Okay. And any tenderness here?
No.
And I'm going to have you just lift your head up off the pillow and tighten your belly. All right, and I don't note any hernias, and he has a good musculature to the abdominal area. On deep palpation, I don't note any masses, any organs, anything like that. All right.